found the time to join this discussion, which I will be moderating, which is an unusual role for me, and I'm apologizing from the beginning, not being the best moderator, but I will try to do my best. I want to introduce our platform. It's a future studio. The future studio was established, which is part of Armenia 2041 vision, which we Noubar, Afeyan, and André, Andonian, and many other our friends in 2001, when was the Armenia 2020 was launched. It's main our goal to discuss about the future. World can be interconnected and see the future of the state and the nation, and to work together with the government to make this future bright. I want to say also thank you to all the staff organizers and also the other our institutions supported by like Aurora, FAST Foundation, IDEA Foundation, United World College, Ameria Bank, healthcare platform, Tree of Life, Climate U-Turn platform. I think it's all about what we've been doing in Armenia, how we can bring this ecosystem, which can what's going in a country level and in the world level, not just project by project, but like one ecosystem. And I thought that this was very important about what's happening now in the world with the virus, because it's really creating so many challenges. It's not only about healthcare issues, it's not only about infrastructure of healthcare, it's much broader issues which we are facing today. It's a political crisis. It's a people are really becoming more and more panic now. To avoid this, it's having open, frank, and discussion with the professionals who understand what's going on. I want to just say today we'll have a presentation about something which I'm sure with the people who today in the panel, it's really we get one of the best speakers who can talk about this subject. I want to introduce the panelists, and this is I will start with Dr. I will say I won't go by the way which is introducing the people who will be speak first. David Noubar. Dr. David Noubar is our special representative of UN Secretary General for Food Security and Nutrition and Coordination for the Scale and Fish Movement. He also serves as a senior UN system coordinator for avian and pandemic influenza. He is a high-level task force coordinator for the food security crisis for 5 years, beginning from 2009. And he is one of the unique specialists of the knowing what's going in the world today in this coronavirus. Say what's going in the world, how you see the situation, national institution can challenging time.
I just want to make a comment as I start. Ruben, for some reason, your voice is cutting out about half of the time. And so I didn't hear everything that you said, but I think I understand. And I think that you were inviting me to make some remarks. And so if that's okay, I'll just check the chat to see what it was. Just want to check that you were giving me the floor. Is that correct, please? Okay, if any, oh, right, okay, thank you, Noubar.
I'm sorry, we're trying to change the system. Yeah, let's, yeah.
Thank you very much indeed.
Yeah.
And thank you, colleagues, for the chance to join. I'm really honored to be part of this panel discussion. And I am so pleased that there is a broad group of people participating in the call. Thank you. Now, what I'd like to do for everybody on this call is to offer a brief account of where we are with the pandemic of COVID-19, an understanding of then the trajectory that I believe this pandemic is going to follow. And then I'd like to consider some of the particular actions that need to be taken in order to bring the situation to a stage where it is properly contained, and then how in future societies everywhere, but particularly in your location, will be able to come together to make certain that the damage, both for people and for economies and social fabric, is as limited as it possibly can be. I'm talking in my role as a WHO special envoy on COVID-19, and I am going to do all I can to amplify and interpret the guidance from the World Health Organization. I appreciate that at times I may not be able to completely address all the points that are relevant, but I will do my best. I will speak at this pace just because I know there is some translation underway. The COVID-19 outbreak is caused by a coronavirus that we have known about for between 3 and 4 months. It's a new virus, and we are learning about it all the time. One of the things we've learned is that to base any analysis and projections on other virus outbreaks, for example, Ebola or influenza, is potentially unwise, because we're seeing that this virus has a different behavior from others. First thing about it is that it is highly transmissible. The average number of people infected by a person with COVID-19 is between 2 and 3, but that actually masks a huge variation. Some people are capable of transmitting very widely, others transmit much less, and that has a huge amount to do with the amount of virus that they are secreting and also the contacts they have with others. Because this is a virus that is born through droplet infection. That means that when people cough or sneeze or even talk, there are droplets coming out of their mouths, and those droplets, if they've got the virus inside their own respiratory system, can jump and infect another person if the other person is within a range that is nearer than 2 meters. So the strategy for dealing with this new virus is to encourage distancing between people. And the best way to do that when people are infected is to isolate them as quickly as possible and to test them, confirm the diagnosis, and then to make sure that they are not in contact with other people during that period of isolation. If they're isolated with their families have to be presumed to be likely to be infected as well, and so the whole family must be isolated. In addition, if somebody is shown to have the disease, it's necessary to find those with whom they've been in contact and to trace those contacts, and then to encourage them to isolate, or alternatively to put them in quarantine, and at the same time to check them for symptoms and test them if they develop symptoms. People are infectious with this disease 2 days before they have symptoms, and then for some days afterwards. That's when they have their highest viral load. The symptoms are as follows. You have 2 days of feeling generally unwell. During that time, you may lose your sense of taste and smell. And then after those 2 days, there's a quite rapid high fever with dry cough, shortness of breath, and tightness around the chest. Out of every 100 people who are known to have COVID-19 in the various studies that have been done, about 80% have a very mild illness, 20% have a severe illness, and between 1 and 3 or 4% may die. the people who are most likely to die, particularly early on in their infection, are people who are older with other conditions, for example, diabetes or hypertension, or any kind of respiratory condition. And so there's been a lot of emphasis put on trying to make sure that those who are particularly susceptible are actually given special care and are encouraged to isolate even when they haven't been in contact with a person with the disease. This basic strategy of interrupting transmission through detection and isolation is the mainstay of all efforts to contain and suppress outbreaks of COVID-19 when they develop in a community. The quicker the interruption of transmission is done, the easier it is to contain a little outbreak as it emerges. Because what happens is that the individual infects others and a chain of transmission develops. And if that chain of transmission continues without any kind of interruption, then it becomes a cluster. And then over time, there is widespread transmission in the community. We've seen situations where there's widespread community transmission in some quite intense outbreaks that have developed in China and in South Korea and also in Singapore. We've also seen intense community transmission in Iran, in Italy, and now also in Spain, in France, in the United States, particularly New York, in Massachusetts, in California, in Washington State, but in the picture in the United States of one of a growing number of intense transmission outbreaks that, when taken together, show that the United States is now becoming a very intense area for transmission. Now, in order to try to facilitate this effort of interrupting transmission, countries have recognized that they can do an awful lot to reduce opportunities for transmission by encouraging people to maintain physical distancing of more than 2 meters apart from each other at all times. The first effort in many countries was to encourage people not to be close to each other. The second was to lock down the economy to actually make it more necessary for people to actually maintain physical distance. And of course, these lockdowns, which are now being undertaken in more than 40 different settings, affecting 2.2 billion people at least, these lockdowns carry with them enormous social and economic consequences. We're seeing in many locations that people who are not in regular employment but are dependent on intermittent opportunities to earn cash, these people are those that are most at risk because they have no buffer, rapidly become poor, and if they are not given support, then that can have further consequences for themselves as well as for their economies. And we're seeing numerous reports of small and medium enterprises going into very difficult situations, and of individual self-employed people being in really big difficulty. So there's a huge pressure on governments everywhere not to impose lockdown for very long periods and to find exit strategies out of these lockdowns. Now, all this is taking place against a backdrop of a pandemic that is increasing exponentially. It's quite difficult for us to grasp what exponential growth really means in practice. But if we look at some of the data from WHO, admittedly based on incomplete testing, we find that the reports of the first 100,000 cases of COVID appeared after 67 days. The number reached 200,000 after 11 days, 300,000 after 4 more days, 400,000 in total after 2 more days, and we've surpassed 500,000 within less than 2 days. That's a very rapid acceleration, and modelers suggest that the whole pandemic is doubling in scale about every 2.5 days, and the numbers are certainly less than what we know is happening in society. So we believe that this rapid growth is actually occurring on a much wider basis than the figures suggest. And so with this acceleration, governments are realizing now that unless they take extremely robust action to try to reduce opportunities for transmission, their chances of reaching a situation where the outbreak curve starts to bend and the increase in numbers starts to reduce, their opportunities for doing this are limited if they wait too long before imposing strong action. There is, of course, a great deal of criticism of different governments around the world for acting slowly when the evidence from China, from South Korea, and from Singapore was that rapid and robust responses are necessary. The current strategy being pursued by WHO and being really set forward to countries everywhere is, number one, make sure you do have capacity at community level to be able to interrupt transmission by identifying and isolating cases of COVID quickly and making sure that they do stay isolated. And that strategy, with its associated finding contacts and tracing them and keeping them under review, that strategy is now very much being advanced. And as the disease goes into a number of countries where it's only in very small amount, there is a huge effort to try to persuade the governments of those countries to implement the interruption strategy immediately with good quality, community-based public health services. And this is not simply just having people in the community who are there ready to offer advice. It's actually covering whole populations and keeping an eye on them individually to find those who are ill and making sure they are isolating and also get the support they need. And also in that process, finding those who need medical attention and making sure that they can get to hospitals that are equipped to treat people with COVID-19 with the proper attention to the health of staff as well as the survival of patients. There is now a global market failure in personal protective equipment for health workers, as well as for some of the material they need to keep people alive. So we've got a market failure on the personal protective equipment, or PPE for short, a market failure on masks, and real shortages for many countries of being able to access ventilators in order to keep people oxygenated, and the other pieces of equipment to go with that, in particular oxygen, either through cylinders or through central supplies. This availability of hospital services, though, is key, because if people feel that if they're being asked to isolate and change their behavior, they can't get access to care when they're ill, then they in turn get very demoralized and they worry for the well-being of older people. And if health workers feel that they're being asked to work without adequate protection and or training and the materials that they need, they also get extremely demoralized. So as well as organizing the public health services in the community, we're also encouraging countries to make every effort to get the right kind of hospital care prepared. Once a few cases are there, you can do it. Once there's a lockdown, you have a little bit of leeway. But the moment the lockdown releases and transmission is strong, then health services get quickly overwhelmed. We're asking all government leaders to prioritize interruption and to make sure that they can interrupt transmission and get it strong when they're doing lockdowns, so that when they release lockdowns, they don't get a great flood of cases and have to reimpose the lockdown, which we believe will create massive physical disturbance as well as continued economic challenges. And therefore, trying to get governments to focus on where this is going, to look 2 or 3 weeks ahead all the time, is part of our effort to get them prepared. We're also encouraging governments to recognize that if they are unable to prioritize some of the essential things that people need, particularly food and water, then that in turn will add to the problem. So there is a lot of work underway now to look at food systems, and we can see, and this is relevant to you, that already Kazakhstan has said that they're going to restrict exports of wheat. And if this habit of countries introducing food export bans goes on and it becomes a domino effect, this creates the conditions for challenges in the global food system. Currently, the Food and Agriculture Organization says that the stocks of food, particularly grains in the world, are reasonably good, but that doesn't alter the fact that because there is a crisis, those who have food are tending to hold on to it, and that applies to households, communities, local authorities, national governments. And when that practice happens, then prices start to go up in local markets. So the combination of people being in financial difficulty because of the effects of lockdowns and rising food prices is a real concern. And in discussions with colleagues in India in the last few days, the challenge of ensuring food security for those on low incomes becomes increasingly important. As we look ahead, we anticipate that more and more countries will find that through lockdowns, accompanied by community level efforts to interrupt transmission, they are able to slow the speed with which individual outbreaks are developing. So the doubling time extends from 2.5 days to say 10 days, as we're seeing in South Korea. This is a very different kind of outbreak curve. And so these delaying tactics are key, but I have to keep stressing that containing and suppressing the small outbreaks as they begin is absolutely essential. And without that capacity, withdrawal of lockdown becomes very difficult. In the long term, we're saying that humanity is going to have to live with this virus because it's very unlikely that in the foreseeable future, there will be a level of people in the population with sufficient immunity for the outbreaks not to progress as we have been seeing them, and for a kind of steady state to emerge. But instead, what we're saying is that countries everywhere need to remain on permanent alert to be able to identify cases quickly and close down and suppress outbreaks as quickly as possible. We'll have to live with that. And the situation where that might change is if there is a vaccine available that's widely administered. At the moment, we do not know whether a person who has had COVID-19 has lifelong immunity to reinfection. It's so difficult to make predictions, and coronaviruses and the immune response to coronaviruses, I am told, and some of you may know better, is a very tricky challenge because developing a vaccine against coronavirus is not a straightforward issue, and immunity against coronaviruses is very variable in terms of the ones we know. So I'm saying, please don't assume that we will reach a point where there is widespread herd immunity in populations and include that in your strategies. At least for now, we are saying that that's an unwise strategy because that will lead to a lot of mortality and morbidity, overloaded health services, and we still don't know whether this virus is capable over time of having much worse repercussions for younger people. There is early data from Italy suggesting that their intensive care units have got a younger population in them overall than those that have been seen in some other geographies. Last point is just, I do think that the role of the scientific community in doing well-coordinated research is absolutely key. Research into the development of different kinds of diagnostic tests so that virus tests, which we need at the beginning of an infection, are available in large numbers all over the world, and that countries don't have to therefore resort to minimalist testing. It's very hard to fight a virus, and we're in a war against this virus without knowing where it is. Secondly, we need sensitive and specific antibody tests in order to check to see the extent of asymptomatic infection in communities. There's quite a lot of confusing data available, suggesting in some cases that the asymptomatics are only perhaps double the number of people with symptoms, others saying that there's more widespread asymptomatic transmission. So reliable serology testing is vitally needed, and there's a race to find those which don't cross-react with other coronaviruses. Of course, we do need to get better understanding what treatments work, especially when they, for example, mildly antiviral activity of chloroquine or hydroxychloroquine is bandied around as something that could make a huge difference. At the moment, the feelings of people in WHO is that this is certainly a drug that has mild antiviral capacity, but when people have got a large amount of virus, it's not clear that it contributes. There are aspects of the way in which COVID affects cells, which means that there are certain classes of drug that may be useful. And there is evidence from Italian studies that those who are on various antihypertensive medicines may do better when they do have to go into intensive care than those that are not. And that's ACE inhibitors and angiotensin reuptake blockers. But this is all speculative, and a lot more work is needed, including on the classes of antivirals that we've used for other viral infections like the oseltamivir group. That too there's still uncertainty about their utility. And then lastly, I know that many of you are interested in vaccine development. I'm not up to date on where things stand, but everybody is moving quite fast. All I would say is that having looked at other vaccine development efforts in the midst of other outbreaks, there is quite a time lag between having a candidate antigen and then moving through phase 1, phase 2, and phase 3 trials to a point where governments are prepared to license. And in this case, it would be licensing by individual nations of a vaccine that would be needed by all sorts of people, including giving priority to health workers. And so establishing a strategy agreed between nations for the administration of a vaccine will take some time, and it's got to be got right. It is a time for all of us where cooperation between nations is key. I work very closely with Dr. Hans Kluge, the Regional Director General for the World Health Organization based in Copenhagen. And if there are issues to do with government policy that come up, I will revert back and discuss with Dr. Kluge, because that he is the main person for the World Health Organization who's interacting with governments, and I support him in his work. I hope that that's useful as an introduction, and we'll be very pleased, obviously, to answer or clarify if there are points that are not clear. Thank you.
Thank you, Dr. Noubar. I hope we can hear me better now. I cut off my introduction speech. I made it shorter because I realized the technology is not working best, and usually when you need it. First, thank you very much for this very deep and wide description of what's happening. And I think it was very important to have a big picture. If I may ask two questions following with what you just said. First, how you see the international organization role to keep this cooperation in life, because isolation and each of the states doing it on and not having really good coordination is becoming one of the questions with people concerned, because each of the states and each of the region can try to do something themselves. And the second question, why is there so big difference between the different the numbers in different countries? What's the main point? Why in the different countries have a different result? It's a question about infrastructure, it's a question about the different behavior, it's a question of the speed when the government interfere. What the main point, why in a different region of the part of the world have a different statistics now? Because many speculations happening around these numbers, and people concerned with this is people not, the states not giving the true numbers, or people have no understanding what's going on. Can you just a little bit explain these two elements?
Thank you. Of course, these are really difficult questions you ask, Ruben, and they're things that I'm dealing with all the time. Let me just start with the differences in numbers around the world. Remember that a pandemic like this is made up of a huge number of different outbreaks, and each outbreak has its own characteristics, and the pattern of an outbreak depends hugely on the extent to which there has been a lot of activity and movement at the beginning, because that determines the pattern of spread. And the countries that have been able to interrupt transmission very early, as soon as any little outbreak emerges, are the countries that have been able to have slower doubling rates of their cases. And so we can very quickly see that there is real virtue in that approach. So South Korea and Singapore are showing a different pattern compared with others. Secondly, the numbers are, of course, estimates. They depend hugely on whether or not testing is done. And different countries have adopted different testing strategies. And so interpreting the numbers has to take account of the reality that we are often really a bit blind as to where things are. I don't think it's hiding. And I can't, of course, there will be pressures on certain people to conceal. And even we hear stories of health workers who really badly want to work and to save lives, actually knowing that they might have COVID, but continue working because they feel that they have to do so. So there are some quite strong temptations to conceal at the local level, at the national level, and internationally. But by and large, my approach is to just work with the information we have. Of course, we're seeing that different countries are at different stages. For example, in much of Africa, we believe that still there are quite a lot of small outbreaks and that very effective early action can get them under control. Whereas in Italy, there was a period when transmission was missed. I think that the Italians are prepared to agree to that they didn't quite realize what was going on. And that led to the brewing up of a huge outbreak in northern Italy. And there was also quite a lot of movement in Italy between the north and other parts of the country before the lockdown really started, which seeded the disease into other places. And that has been going on all over Europe, the seeding from places where there's high levels of community transmission. And that means that in Europe now, we are anticipating a number of intense outbreaks suddenly emerging. We'll detect them probably through the flooding of hospitals with cases, because we always have to remember that the current caseload is a sign of transmission that was taking place 10 days ago. And then lastly, I do want to stress to you that we still don't have a full understanding of the susceptibility of different populations. So the story from Italy and Spain, people are saying perhaps one of the reasons for the high mortality rate there is because of the age structure of the population. That, of course, has to be set against the other data that we've got that suggests that the current distribution of people in northern Italian intensive care units has a slightly younger tail. I'm sorry I can't really fully answer, but all this is about trying to make sense of massive uncertainty and also real variations in data and the kind of data that are available. And so the task at all times is to try to establish a pattern and to be able to communicate that pattern that's based on whatever data are currently available. And of course, because we're having shifted data and an exponential pandemic, the actual judgment about what's happening has to be adapted about every 2 or 3 days. Now, international cooperation. I mean, I want to be absolutely straight with you all, that somebody like me who's worked on global issues quite a lot in my life has always worked hard to ensure that wherever possible, we have complete cooperation between nations that is based on trust and common purpose. Now, we were able to achieve this with Ebola. It took some time and it took a lot of careful confidence building measures. At the moment on this particular COVID, we're right at the beginning of being able to establish strong international cooperation. There are a number of strains in interrelations between global leaders right now, which are based on stuff that's nothing to do with COVID, but they are getting in the way of what is required for a global emergency, which is to have constant communication and unified action with clear principles that are understood and accepted by everybody, and then that are applied with in varying ways in different locations, but all the time keeping the principles in place. So to have a united strategic approach with varied implementation using standard principles has been our collective goal. And WHO has authority to serve as the coordinating body in dealing with an emergency, but that authority depends so much on whether individual governments are prepared to give it the power to take a leadership role. In the run-up to the G20 telephone call that took place on Thursday, it was agreed that WHO and the UN should be present, but it was not agreed that they should be given the authority to draw together everybody, at least for a short period while we're dealing with this emergency. I think this will change because of the speed with which this pandemic is accelerating. Leaders are reassessing their approach and are shifting their view of the need for cooperation over time. But I'm still finding, even today in my discussions with leaders directly or through the media in the last 2 days, we're not quite at the point where that form of cooperation that leads to unified global strategy and implemented in appropriate ways in different locations, we're not there yet. However, I sense that there is a groundswell building, particularly among leaders of countries that are not in the G20 and leaders of groups of countries that are really concerned about the economic and societal damage, that the pressure will build during the next few days on the G20 to just be a little bit more focused on unity. Because if that doesn't happen, then I think we are really going to be hampered in this fight. And I connect wherever possible with those who can have some influence on members of the G20, just stressing what the potential consequences of an inability to be united might lead to. It's no good saying WHO is failing on this, just as a sort of knee-jerk reaction. I had to deal with that today from a number of commentators, because WHO's capacity to combine actors together and get them to unite is limited by the willingness of those actors to do so. So continued dialogue with the leaders of major governments, particularly the P5, and then some of the very populous major economies that are in the wider G20 is absolutely essential through whatever means we can find.
Thank you very much. Thank you very much. If I may go to now what's happening in Armenia, to the Minister of Healthcare, Arsen Torosyan. First of all, thank you very much. I know how busy you are now in this time and how big pressure you got from what's happening in Armenia. And of course, one of the challenges that you're facing, how to handle this all and situation when nobody really knows all the answer. But what's going in Armenia? What is the main challenges? How the international community can help you, if we can help anyway. It's also, you know, with our challenge program, what we've been part of Aurora, which is chaired by Darzi selection committee, and we co-founded by Noubar, Afeyan, myself, and provided 10 ventilators to Armenian hospital. But what is the real help can be done from the international global communities, Armenian and non-Armenian, and also how volunteers and internal people can support something which needs to be done? What do you see the key challenges and key issues that you are now handling in Armenia? If I may ask you open questions to Minister, to understand it's a lot of questions and not so many easy answers, but we'll appreciate about your explanation and position. What you
Thank you very much, Ruben, for this opportunity to speak with experts in the field like David Navarro, whose introduction was very useful to all of us, to the ministry staff, to our audience, and thank you for this opportunity to introduce what we have now in Armenia. Actually, I've written down some points to go through, and I think it's very important to start from very beginning, because we, as a Ministry of Health and then as a government, started to concentrate our attention to this issue from mid-January, and because we had very specific challenge that the visa-free regime for Chinese citizens went into force just when the outbreaks started in China, and we had to act very quickly to restrict the potential entry of the virus with the Chinese citizens into Armenia, and we acted very quickly and just stopped this visa-free regime, and which I think allowed us to have a lot of time to get prepared for the cases in Armenia. The same is done with Iran, and which are our closest neighbor, and even Dr. Navarro emphasized the case of Iran as an exceptional before Italy, actually. And we had to act very quickly, and we succeeded, I guess. The whole government mobilized their resources, decision-making processes are done very quickly. We had even actually adopted a government decree that interagency body created in the in the end of the January, which coordinated all the things through now. As of now, I would say that the first case was diagnosed in the 1st of March, but then we had a kind of grace period for the second case. The first case was from Iran, and the second case and the third case was from Italy. And after the second case, we had growing numbers of cases because of the local transmission. And now as of actually morning, for Armenia, we have 372 cases, out of which 28 are healed or recovered or virus-free, we can say so. And we have one fatality. What we do now as anti-epidemic or pandemic measures is mainly in line with what WHO and UN and international community suggest. This is a limitation of movements of people. Actually, the country is on the total lockdown now for a period of week, but it can be revised, to have more, to extend for a week or so. We have a system in place for testing of the suspected cases, tracing the cases, isolating the contacts, mainly in the special cases like hotels or so, self-isolating of second contacts or people that travel to Armenia from the risk zones, the number of countries is now very big, actually more than 20 countries, and the list is getting more and more extending. Yeah. And the treatment, of course. For the treatment, I can say that we try to use the drugs or methods that are actually not totally evidence-based, because we have very short time to justify everything, the international scientific research community. But we use the chloroquine, we use the antiretroviral drugs, from actually a week for a period of week or so, and we will have our own results soon, I guess. The second part for the treatment is that we are actually creating a branch in the health system to deal only with coronavirus. We are mobilizing either abandoned or not fully loaded hospitals just to deal with coronavirus with beds. We are mobilizing about 700 beds for only coronavirus, with about 70 to 80 ICU beds, which also can be extended to a bit more. Of course, we face lots of challenges, starting from personal protective equipment that we have insured, and actually all countries now insured of this personal protective equipment. But this is very keen and very crucial to break the transmission cycles, because if medical doctors, like in Italy, or nurses get infected, they transmit the disease in hospitals, and the people who are sick and who have chronic conditions, or our elderly citizens can get infected, and we will have, actually any country would have lots of fatalities. So the personal protective equipment, I think, is more important than even having ventilators in ICUs. Because if you have like hundreds or thousands or even tens of thousands cases, I think any healthcare system cannot handle, no healthcare system cannot handle this cases, this number of cases. So we try to buy PPEs from mainly from China, but also everybody, as everybody knows, we have lots of logistic programs, because flights are shut down to the lots of directions. The land transport is very slow, plus lots of land borders are closed now. Actually, all our land borders now are closed, except of course for cargo, but again, there are limitations for cargo too. For instance, if the driver of a truck has a high temperature, he is not allowed to enter the country, to Armenia. So we mobilize even our air cargo resources to have charter flights from different countries for PPEs and equipment, plus charter flights to actually evacuate Armenian citizens to Armenia. For the international support, of course, we started to involve our all international partners, starting from UN agencies. This is mainly, of course, WHO, European office and Armenian office. UN, other agencies like World Food Program is trying to help us to get some PPEs and equipment, tests, of course, the tests too. I would refer a bit to tests. We use only PCR tests and try to stick to them and have more capacities to do PCRs, and we try to avoid rapid testing, as our specialists suggest that they are not very specific and sensitive, and we see now the international media reporting that several countries failed to introduce this testing, like screening for systems, because of the flaws in the tests, mainly again coming from China, Spain, our neighbor Georgia, and we try to increase our capacities only for PCR testing. It is very difficult, it is very expensive, but it is very correct, I guess. And for the other international support and coordination, we work very closely with our neighbors countries. So except from the transnational organizations like UN or WHO agencies, we try to work closely with our neighboring countries, with Russia, from which we get a lot of support, mainly for testing equipment. with China. We work very closely with China, and we see that China is trying to help more and more countries. And using their technical experience, how they did, how they succeeded, plus using their capacities to provide the PPEs and equipment. Of course, Armenian community and Armenian diaspora also helps us mainly from US, and we are continuing to these efforts to see how they can continue to help us. Though we understand that US is now another burning point or area in the map of the world, but I think that this cross-country or cross-national support can help nations like Armenia have face this challenge with less damage, I guess, because now we are in the phase of damage control, something like that. And for the economy and for the health system particularly, and for the spread of the disease. So again, just summarizing what I've said, we do stick to the proposals from the WHO and other international partners to find suspect cases, to test them, to trace them, to isolate the contacts, to treat them, and break the transmission cycles as much as possible, and hoping for the vaccine and for the specific treatment to come out. Because as again Dr. Noubar stated, there cannot be an expectation that this will end soon. We have to get ready for the long-term interventions, and all governments actually have to do this. And I can say that Armenian government understands this, that this is not an issue of one or month, and we have to be ready for these long-term interventions. I would be very happy to answer the specific questions if there are.
Thank you. Thank you. Before we're going to the next panel and come back to some question, I want one more question about the volunteers. We heard in many countries people willing to support, because today the main message for all the societies saying stay in home, behave correctly, try to keep the rules, don't violate the private, again, try to follow all the rules. And this is the only way you can help, the best way to help. But there are a lot of volunteers. We heard about 400,000 people in UK. We heard in Armenia was 2,000 people. And we also know it's one of the issue about not enough places to put the people with quarantine, not enough nurses, not enough medical service people. Do we see any programs of short-term education program where we can help people be educated and help support the infrastructure? Because we saw in Italy how the medical people been basically working 24 hours, 7 days a week, and getting a lot of by infections because of the too many pressure to them. Do you see the volunteers can help some way to decrease the pressure, or it's not realistic?
Thank you. It's a very good question. Actually, we have two kinds of volunteers. First type of volunteers are those who can help with logistic, with paramedical support, let's say so, that we have now, and we have several thousand people that sign up for this volunteering, and we try to select those who are in the age and condition that are less risky for them to get involved, not to harm them, and then to provide some very basic training for epidemiology issues, how to protect themselves, how not to get infected. And the second type of volunteers are medical staff, actually, that are not dealing with the infectious diseases or epidemiology in general life, in their general working life. And we mobilize them to retrain, actually, as doctors or as nurses who can deal with patients with coronavirus. And so far, we have trained about more than 100 of doctors and nurses for a short period of time, like for 3 or 4 days, with the basics of epidemiology, how to protect themselves and how to approach these patients. And second, the basics of like pulmonology and infectious diseases that can be a substitute for those doctors who get infected. And it's very pity for us, but we have now several, actually, a nurse and a doctor from an infectious disease hospital that got coronavirus. And also we have lots of elderly doctors and nurses that should be, actually must be substituted as quickly as possible, not to put them under the danger. So the volunteering, of course, and mobilizing the volunteers is one of the main directions to provide the continuity of the service, because medical staff is warning out, or actually warning down, I don't know the exact, yeah, yes, thank you.
Thank you. If I may move to Lord Ara Darzi, the former Minister of Healthcare of UK, and now he's the Director of Institute of Global Health Innovation in Imperial College, and one of the key specialists of the using artificial intellect to robot to some of the new areas. But also he's the chairing of the Aurora Humanitarian Prize Selection Committee, and he's the International Advisory Board member of our Foundation of Armenian Science and Technology FAST. And he also advising many other governments like Kuwait, Qatar, and Kuwait, and running a lot of different institutions. If I may ask Arajan, what do you think about this all happening? What is the key challenges for the hospitals? Because managing hospitals now are becoming one of the big challenges, and you are active surgery. Also, not only, by the way, we're talking about coronavirus patient, but also other patient is facing some challenge now, how we'll get the serve. And of course, UK situation was quite unique. If I may ask you to a little bit explain, because people was confused about messages, what was the UK approach to the coronavirus was a little bit different compared to China or South Korea or Singapore. And we heard a lot of different stories about this, and it'll be good to get from you directly what your view about what was done in UK, what was right or wrong, and how you see the situation, and of course the challenges with the facing the hospitals and general healthcare system. What do you see the solution of this, if any?
Thank you. Thank you very much, Ruben. And may I thank you personally for putting this on. Thanks for your leadership at a time of crises, not just in Armenia, but also globally. But also to send my warm wishes to many Armenians who are listening to this. These are difficult times. Fear is not an issue that you can manage easily. And I think this will empower many people watching. What could they do personally in terms of dealing with this crisis? I think David Nabarro, who very, very eloquently described the whole background globally. And may I just say, whatever he described is exactly the same happening at every country level. This virus doesn't know any boundaries, doesn't know anything about race or religion, doesn't even know if you're a prime minister or not, as you probably have heard in the last 24 hours. The combination of our prime minister, but also the Minister of Health, have gone into self-isolation. So I think I'm not going to say more what David said, and also what His Excellency, the Health Minister in Armenia, said. I think the only way in which we're going to manage this, or at least try to get on top of it, is through the public health interventions that have already been rehearsed. The only thing I could say, the virus is still in the driving seat. The virus is still well ahead of all of us in whatever we're trying to do. So I'm going to talk more from a hospital perspective, healthcare perspective, rather than the health or the transmission rates. There is no healthcare system in the world, even in the best systems, whichever way you look at, that has the capacity to deal with what David described, the 15 or 20% of the population who are going to get a severe disease. The only thing we can do to reduce this burden in terms of mortality is to get the balance right between the demand and the supply. As I said, the supply is fairly limited. In other words, the supply of health services. So I hope everyone listened to David in terms of what needs to be done out there. And what we are praying in the hospitals is how do we reduce this peak and extend, if you like, the curve, so the demand, we can at least manage the demand by having enough supply in terms of hospital beds. I think overshooting the supply of beds in hospitals, and that is probably the determinant of the mortality. And we've seen that in Italy, we've seen that in Spain, and I fear we're going to see this in the US as well. So shielding patients at the biggest risk is something else we've done in the UK, and that's one of our successful interventions. Having a single system, the Ministry of Health looked at the whole population of 63 million and identified 1.5 million patients who have to go into isolation for a period of 12 weeks. The majority of these patients have what we call a comorbidity, people like who've had a transplant before, people who've had certain cancer. They've gone into complete social isolation for a period of 12 weeks. To support them, we have managed to get volunteers. We put a call out for volunteers. Believe it or not, within 48 hours, there were 600 or 700,000 volunteers who are happy to go to these people's houses, supply them with food and all the support they may need. The second thing in terms of dealing with the supply issue is to increase the capacity of the beds. So I am a cancer surgeon. I am currently unemployed because all the elective work in a hospital has been cancelled. All the capacity that we have in a hospital setting is being dedicated for this work. And may I just add to that, it also includes the private hospitals. So the government, through its health security bill that went through Parliament recently, has done a contractual obligation with the private sector to release all the intensive care capacity, but at the same time freeing all the private sector capacity to deal with this pandemic. We also had to significantly increase our ventilation capacity because out of the 15 to 20%, we expect there will be about a 10% to 15% requiring ventilation. That means we need more ventilators. We need to expand our critical bed capacity. Ventilators are in shortage globally, but we've managed to find other creative ways of doing it. You probably have heard President Trump overnight instructed GM Motors to produce ventilators. In the United Kingdom, Dyson is about to start production of ventilators to meet this huge surge in demand. Ventilators is one thing. You also need people who run these ventilators. So being unemployed, yesterday I did a whole day course in critical care management. So I'm going to be, if you like, working under the supervision of an anesthetist in critical care facilities to run ventilators. So a lot of volunteers are coming in who are doing other activities in the past which are no longer required, like dermatology clinics, cardiologists. We're all coming in to get our, if you like, upskilling or reskilling in managing this burden. Obviously, there's a lot of work on research, vaccines. I'll leave that to Noubar to talk about. We're also increasing the capacity of our bed base. You may have heard that Excel Center, which is a huge center mostly for entertainment, concerts, has been converted to a hospital with 4,000 beds. We put a call out for volunteers. These are NHS retired clinicians and nurses to come back, retrain, and they will be running the Excel facility. And there's a similar one in the Midlands in which a non-healthcare infrastructure is being converted to an emergency hospital. On the volunteering side, we've done very well. As I said earlier, volunteering to help these 1.5 million citizens who are at risk, but also many, many volunteers in the health sector. I'm going to move on to another issue on staff in terms of their safety. We did have a difficulty at the beginning in screening staff in terms of access to PCR. That's taken about 2 weeks to correct. This weekend, we will start having a ring-fence capacity to screen our staff, because the problem we had with staff, that includes me, by the way, about 2 weeks ago, where a member of my family caught the virus. So I had to go in isolation with the family for 2 weeks. That is not sustainable as we move into this phase, which starts probably at the end of this week or this coming week of the surge. So staff will be tested there and then with the results, and that's PCR testing. We have been testing some of the rapid PCR technologies. We believe there are a couple now that might be useful in that. In terms of also bringing in antibody testing, because a lot of our staff who have been infected, we need to call them back. These are the people who could make a significant contribution. There's been a lot of concern in the UK on the personal protection equipment. The first is on the guidance. Where do you use this? Where do you need to use this? And we now have an independent policy, which is published yesterday, bringing clarity who needs what level of PPE in terms of their protection in different levels of critical care versus even the use of PPE in social care in the community. So that's been another move. We've been a bit slow on that, but things have moved on. I think the other controversy you referred to earlier is this whole concept of modeling and what's happening in the community, and this whole concept of so-called herd community, which was a bit of a surprise. I think it was a slip of the tongue at one of the press conferences. But let me come back to modeling. Maybe David could say a few words about this. I'm a scientist. I do believe in data. I do believe in analytics, and I do believe in models. However, models are as good as what you feed a model with. In other words, if you have adequate population numbers that you've screened and you trust your data, your model is never going to be working. It will also, the danger with models could give you the false sense of security, what's happening out in the community. So David was very eloquent and very diplomatic in the way he explained this. If you don't know what is the prevalence of this infection, if you don't know what the reproduction rate of this virus is, you cannot believe the models. You believe what you know. And what we know historically in any pandemic, you come down, top down, and you intervene. And the only way in which you're going to reduce the reproduction model is by isolation. In other words, by social interventions. And we've seen some of the interventions, and now we are in the more critical bit of that social intervention, which is the lockdown. And in a lockdown, you're trying to achieve is to reduce this reproduction rate from what it is at the moment, 2.4 to 3, down to 1. Then you will have control, and you can at least manage the supply of hospital services to meet this demand. And sadly, what we're looking in the United States at the moment, there is absolutely no control on the reproduction rate. So in the beginning, we had this, again, academic or intellectual thing. If we allow the reproduction rate to drop, but not to 1, to get the 80% of the population who may have a mild illness, we may provide this herd immunity. But life doesn't work that way. And so I don't want to confuse it further. We are where we are. On the other hand, though, I think I'd like to make one or two other points about the lockdown. Lockdown doesn't work for a long time. At best, you probably could push it to about 3 weeks, maybe 4 weeks. You will see a lot of social disturbance if you continue that beyond those 3 to 4 weeks. And let's not forget the economic impact on this. And I know later on we will be talking about it, at least touching on the economic impact, but let's not forget the economic impact on health. At economic downturns, the mortality rate also increases. So there's a balancing act here. So lockdowns do work. I'm a great supporter of it, but we need to get on top of it within the next 3 weeks. We envisage our peak to be somewhere at the end of next week or early the week after. And we could be as ready as we are and hoping that we could manage this in the most intelligent and evidence-based way possible. Thank you.
Thank you, Arjen. Thank you, Lord Darzi. Thank you for very deep and important messages that you do for all of us. One of the questions, which, if I may emphasize again, it's a question about what will happen with other patients, because I get some stories of people with needs to be treated same time and getting no attention and no place. How handle this situation? Where is the moral choice? Because as people continue to have a problem with the cancer, people with the kids is dying, and a lot of other things, and people becoming very concerned when you cannot get any services just because it's coronavirus, taking all attention, all resources. How you see the solution of this, if any? Please unmute. You are in mute, Arjen. You're in mute.
Sorry. It's a very good question, and there's a reason there too, and I absolutely support. It's an important question to ask. So what we've done is we've used the critical bed capacity in the private hospitals, in other words, the intensive care beds for COVID use. But we have also taken on the non-intensive care capacity and tried to deal with what we call emergency non-COVID situations, like patients who might be receiving chemotherapy or patients who have had a side effects of chemotherapy. But if a patient who is waiting for cancer surgery, they are mostly being delayed for a couple of weeks because we don't believe it's going to make much of a difference. And there is always a risk of coming in and obviously being infected with COVID. So it's all balancing act. Every patient, whoever is the clinician managing that patient, is being managed in that way. So we haven't 100% stopped. So if someone is going to get a myocardial infarct or a heart attack today, we still have the access facility to allow these patients to be admitted and still have their angiograms and their stent put in. So it's not a complete lockdown. We're only dealing with serious emergency situation in non-COVID patients.
Thank you. Thank you very much. Again, for me, it's a big privilege to be moderator of people who really understand something which I don't understand at all. And I'm moving now for my friend and my partner, for life partner. We've been doing many things last 20 years together. And the first time, Noubar, I will ask you a question which I have zero knowledge. And but I want to go a little broader, maybe ask you 3 groups of questions. One is about, of course, everybody sending us questions to before our event or during this event about the vaccine of Moderna, all about, but I see the broader issue about what the possible scenario, how you see the future of this in general biotech, and how you see the importance of this pandemic, creating the importance of the biotech development, and what it will be. You've been doing this 20 more years, 30 years, and you've been one of the pioneers of this, establishing this Flagship pioneering, and you've been not only Moderna founder, but you've been founding 40 more companies, and in this field, you see will be changes happening in the industry and all, how it will influence overall. And the third part of the question I want to ask you to elaborate whatever is about this, we've been doing together is Armenia 2020, Armenia 2041, Aurora, FAST, Global Armenian Influential Network. How you see the network will become important on this? Can we elaborate having unique advantage to sitting now in this discussion between different part of the world and talking about something which is, again, relevant to all of us. At the same time, it's most of the panelists is Armenian by origin, and yes, we are citizens of the globe, but also we are part of the Armenian network. How you see this part? If I may go with 3 directions, the question you pick out which one you want first and which one second and third, but you have I don't know, 10 minutes more to talk about it.
That's great. Well, look, thanks everybody for doing this. This really is both a privilege, a pleasure, and by its unprecedented nature, hopefully something that we can mobilize and use in the future, because for many years we have thought about what is the advantage of having a broad network of Armenians all around the world, and at times like this, among them should really be to attract both our own expertise and knowledge, but also those of our close friends and colleagues. David, thank you so much for joining in this. You're officially a friend of the Armenians by doing this, and we have these all over the world. Ruben, I'll start. I thought I'd start by just painting from my point of view as a scientist and an entrepreneur, kind of what I think is a defining feature of the moment. And I'm going to try to do something. If it doesn't work, tell me, but this is to share one screen. Is this visible on your screens? Can you guys see this this
Yes.
chart?
Yes.
Okay, great.
Yes.
I put this up. Many of you are seeing these online. This is fairly current, to describe the world that Dr. Navarro described, which is that every single country has this chart of these cases that are going up like wildfire. This is meant to show the various doubling rates, ranging from once a week to once every 2 days, or even faster. Cases that are doubling every day. You see the US now 23 days into this with 100,000 cases. And I put this chart up to just make the point that this, in my view, is nothing short of a global biological war. And I use the words carefully. This is not biological in the sense of man-made, but this is very much an all-out biological war. By the way, in nature, there are many such confrontations. Species go extinct, and we just don't know anything about them. And basically, certain specialists in biological fields follow these and explain why certain things went out of existence. But in fact, this kind of biological war is with precedence, except it hasn't affected humanity quite in this visible way. And there's 2 reasons I mentioned this. This is not the scary part of it. I think we have to treat it as that. I think one of them is that this is kind of a war between a social animal. I never thought I'd use the word in a conversation, but we are social animals, and an invader that uses our social contact to transmit itself. So it's a particular, I would say, attack on our social being. If we were not social animals, if we were trees and we couldn't move around, this would not have a problem. And again, I think we have to realize that this is our vulnerability. This is where isolation is such a key and first point. But we're also social animals that carry with us an immune system, and I'm going to talk a little bit about that, because that has to be deployed in this global biological war. And above all, we also have, as a social animal, technologies. Our intelligence have given us massive amount of technologies to deploy, and while we're being clumsy about getting organized to do so, certainly with the World Health Organization's leadership and many countries following, we're getting better at it. And I think that the prospects of we're not going to lose our socialness in this particular war, but we will suffer casualties because of it. I just think it's important to put it in context. Let me mention a couple of just high-level things then with that said. Many of you know that my activities involve starting biotech companies that explore completely new ways of delivering therapeutics and many other technologies. One of them being this company called Moderna, and I'll just very quickly relate to you. I'm not going to get into the science very much, but Moderna has, over the last 9 years, developed a whole new platform of medicine based on messenger RNA. Messenger RNA is the molecule that exists between DNA and proteins that carries the message, the information from what is our inherited repertoire of genetic potential to whatever protein the body needs to make. And of course, some of those proteins are what the immune system needs to be able to wage this battle, and then mRNA can also be used there. What's important to know is that this technology, even while it's being developed for the last 9 years, has no approved drugs or vaccines that have come from it, but it has over 20 different drugs and vaccines that have been tested in humans. They've been tested in over 2,000 humans across many different disease states, and importantly, 7 of those being vaccines. Now, in the vaccine world, you have to show the effectiveness of the vaccine in a prophylactic setting to prevent the disease, but you also, above all, have to show safety. And we are gaining more and more demonstrations of safety, even while some of the vaccines we've worked on are continuing to go up the learning curve in terms of demonstrating efficacy. We had been working on coronavirus vaccines with the NIH for the last 2 years. We've developed a candidate vaccine for MERS, which has been tested in animals and was getting close to being tested in humans when this pandemic broke out. And at a very early stage, thanks to the close relationship we've had with the NIH, with particularly the NIAID, the infectious disease part, Moderna was asked very rapidly to try to come up with a particular molecule of mRNA that would represent the most vulnerable part, it's believed, of the virus in its ability to infect cells, but also the most distinctive part to be able to use as an antigen for a vaccine. And due to the nature of the technology, we were able to very rapidly make this material, this chemistry in our facilities in Boston, near Boston, and provide it to the NIH. And that testing has begun, as many of you have heard, about 2 weeks ago. The first wave of testing, phase 1, will involve 45 healthy volunteers. There's 3 different dose groups. And as we now progress through each of the dose groups, we expect to have both safety information as well as, importantly, early information of an immune response, which, given the numbers of patients, will be not significant yet, but it will be indicative of going to the next stage, which we hope, upon positive early results, will start in the spring. There is then a phase 2, which will be trying to establish what the ultimate dose of such a vaccine will be, which will be larger. There may be multiple phase 2 trials carried out. We're planning those right now because we really do need to do science, even while we're doing clinical testing, because as Dr. Noubar said, we don't really know a lot about this virus, and there are many different contexts in which we need to think about the vaccine. So there's different ways to test. So we'll do that in a phase 2. And on the ideal situation, the really ideal situation, which we can't rule out, but we can't count on, we're hopeful that come late summer, early fall, we'll be in a position to do a much bigger phase 3 trial, which will really be the pivotal way to demonstrate the vaccine's potential efficacy. Now, in the meantime, there's a lot of investments that needed to be made, and we've begun to make them as well through collaborations with various agencies, particularly the US government, which is stepping in order to produce very large quantities. You cannot go overnight in such a new technology from having thousands of samples, if you will, for testing to hundreds of millions. But the technology that we're using, we believe, will be quite robust and quite scalable. And so we're beginning to manufacture, we're beginning to stockpile, and we think that over the summer, we'll be able to at least have material sufficient, should the need arise, to be able to deploy some of these vaccines for frontline healthcare workers, which under emergency situations may in fact be life-saving. And we will at least be in a position to try that. It's very, very difficult when one enters this to avoid giving hope when everybody wants hope. And so we're very, very careful to say that, you know, we believe that if what we're doing works, and if what everybody else is doing to do vaccines works, we still will not make enough vaccine to supply the world. So this is absolutely not a competition between different companies and different approaches. This is basically a competition between us and the virus. So it's human technology counteracting the human social tendencies we have that makes us vulnerable against a virus that abuses it. Basically, what's where the situation is. Let me just say a couple of other things, and I'm happy if there are questions to go into that again. But more broadly, vaccines are only one approach that are being tried. What is really amazing to see is in the modern state of biotechnology, just how many different ways in which different companies, just within my own sphere, Flagship sphere, are going after it. We are using across multiple approaches artificial intelligence to virtually screen compounds, which you can do now computationally, against various of the data sets that we have about this vaccine and about its infectivity. So there are compounds being kind of identified by analogy to other compounds that are being tested. We have the ability to computationally design antibodies that can go after particular spots in proteins. Never had that before. It's being deployed. There's a company called Generate Biomedicines, whose lead scientist is also an Armenian, Georg Grigoryan. He's working on literally producing hundreds of very specific tailor-made antibodies using computation, and within a couple of weeks producing these. My colleague Avak Kahvejan also is leading a very significant project in drug discovery. And then finally, I'll say, and one interesting thing is that even technologies as remote as the ability to collect blood, which many of us have heard about, this is something that we'd like to be able to do at home. There's technologies now that have not been deployed yet, but now hopefully will be for this pandemic, where literally you can have a device sent to you by mail. Basically, you attach it to your arm. You don't really have a sensation. It draws 100 microliters of blood safely, which you then put into an envelope and send back. And this is, to our knowledge, the only FDA-approved device that can do this. It's a company called 7Sense, and they were not at all working on this. They were working on hemoglobin testing and many other things. And suddenly they stopped everything. The whole company pivoted to try to enable this, because as Dr. Navarro said, one of the biggest things we're going to have to do is to test for seropositivity. That is, in millions of people, we're going to need to test relatively soon whether they've already had the virus, whether they've generated an immune response. And the way to do that will be through blood testing. And you need access to people. You can't bring people to health clinics to have them sampled. And so remote sampling of those people and the ability to test. So these are all things that are part of the technology kind of weaponry that are and logistics that are being developed. So let me just say, let me stop on that and say a couple of other things that I see going forward based on what Ruben, you asked. First, I think that as Lord Darzi mentioned, this is a significant challenge to the healthcare system that we have. and I think that they are acting in heroic ways, but this shouldn't be the way we come out of this crisis and just keep doing what we're doing. One of the things that we've begun to think about is to what extent public health, which has been highly neglected over the years as part of a strong healthcare system, where only a few % of the annual healthcare spend goes into any form of prevention or early detection. How can we convert what looks like a sick care system today to an actual healthcare system? How can we challenge our colleague, the health minister of Armenia, to think of what their job is as health defense, not just healthcare? That is, how can everybody's health be, how can we think about early detection, deterrence, delay, prevention, the way our military thinks about such issues, instead of simply waging battle when a disease takes hold? Because indeed, when a disease takes hold, it could already be too late, and that's what we're observing. So that's one of the areas that we're trying to anticipate, because it's going to be an inevitable consequence. And then the last thing I'll say is the following. I'm standing, I have in my background Mount Ararat, which for the Armenians on this call is obviously symbolic of a lot of things, but among them, for our projects together with Ruben and many others, is really a symbol of survival. If in fact, biblically, this is a story of a second chance for humanity. And I don't want to make this overly dramatic, but we've talked about this for many, many years, independent of a pandemic. Humans are often given second chances. And the question is, what do you do with that second chance? And as Armenians all around the world, we are the product of a second chance. And we have gone through our own journeys of going through the stages of surviving, then reviving, and then hopefully thriving. And we're doing that all around the world. But that journey is familiar to us. And I think that's a journey that unfortunately most, if not all of humanity is now being forced to go through. So I would say the survival instincts that we all have will be essential, to make this battle possible. The optimism, the kind of cautious optimism that we need to have, not to give up, all of those things are familiar to many of us who in our own family stories have had to go through a struggle. But then the question is, what does reviving look like? In other words, what does recovery look like? We're not, anybody who thinks that this is just a bad nightmare and as soon as we wake up, we'll go back to the same thing, I'm afraid is going to be very disappointed. I think that the normal that we used to experience will be quite different going forward, just like after a civil war, just like after any massive prolonged disruption in societies. And the question we have to say is, what constitutes reviving? How do we go back to work? What triggers that? How do we rely on each other? What does trust in government mean? What does trust in large corporations mean? All of these things, which André may want to touch on, are on the table, and we're having many, many discussions across many different fora about this topic. So surviving, going to revival, and then eventually thriving, and thriving in a way that hopefully can prevent these situations. And I say that with the background of Ararat simply to say that I think Armenians should basically keep that symbolism in mind, and everybody is going to wage this battle. This is not unique to us, but at least within our community, we have experience to draw on, we have resilience, and we should use it. Thanks a lot.
Thank you very much. Unfortunately, David Noubar needs to leave for the our next meeting. And I want to say before you leave, just say thank you, how we appreciate your time and your comment, what you deliver. If you want to add anything in the end before leaving, we'll be appreciated. Again, you got a lot of topics that we touch. And of course, one of the things, again, people want to get better understanding what we need, what we can do, how they can be part of this process to help stop this damage as much as we can, and of course how we can keep this cooperation, international organization working together as much as we can also. But David, please, if you want to say just a few words before we...
Just first of all, what an honor to be part of this webinar. I've learned a lot. Firstly, about the thoroughness with which the Armenian government is approaching this threat. Secondly, about the way in which you are collectively working together and learning from each other, the way in which Ara was able to share the British experience, and also from Noubar, just how much exciting science is being brought to bear. And I totally agree with Noubar's last point, that actually coming out of this, things will be different. It's not going back to normal. It'll be a new normal. And as you've heard, and as I'm sure you'll discuss, there's a lot of opportunities to make the new normal even more suitable than the old normal was, for taking advantage of the skills of the human race to deal with existential crisis. Thank you to everybody. And I did read many of the comments and questions, and I'm not able to answer them now, but I will take them on board, and I will find a way to connect with our chair, Ruben, to react to any of those that are directed to me.
Thank you.
Ruben, if you just keep me in touch,
Yes.
please keep me connected. Thank you, everybody.
Thank you. Thank you. Highly appreciate, again, what all you said. I think it's very important for all of us. I want to shift to my other old partner and friend, André Andonian, who been doing with us Armenia 2020 project when the scenario planning of future of Armenia 18 years ago, and been involved on ACFA, which we've been together with Noubar. And of course, everybody worry about the pandemic, and about health care, about the mortality rate, what will happen with the disease, how it's all expanded. But people are now also facing it's a big challenge, and we can see some of the countries' response was different, saying, you know what, we don't want to people be saved, but it will be economic crisis, will kill more people because people will lose the job, it will be a disaster. And I didn't have a time to touch the Sweden example or other places where people try to say, you know, like in Zimbabwe, they say we don't have a healthcare system, we cannot provide support, let's people, whoever die will die, but economic crisis, we cannot afford it. The question of coming, what will become after this, okay, or during this time of the pandemic, how the economy can survive when everything is shut down, people need to stay in home, and what will be happening with the worldwide economy. Are we facing 2008 crisis? Are we going back to big depression to 1930s? What's happening with the economy? How the industries which basically now disappearing. Some of the industries disappeared fully. Some industries needs to be restarting and starting doing new things. And how it's all connected to it. All life, people stay home 1 week, 2 weeks, okay. But when you're staying 3 months, what will be happening? Unemployment will go up. In the US now, we got already 3.2 million unemployment, and it's going up dramatically. And how long people can stay with no salary and the compensation? Again, so many questions are there, I know. And of course, the second part I want to ask the questions about Japan specifically, especially Olympic Games was canceled, which was with huge investment for Japanese government, and it was first time after Second World War. It was also a big challenge for, I'm sure, Japan making this type of big effort to make this Olympics best, and now they need to cancel something which was never happened before after Second World War. And of course, people want to see how the Japan is responding. But before that, unfortunately, Minister of Healthcare also want to apologize, needs to leave before you start asking questions. I want to give for 1 minute or 2 minutes to Mr. Hill respond what's his reaction and what was his takeaway from this meeting. And I want to say again, thank you for your time and commitment in coming to our event.
Thank you very much, Ruben. I'm sorry to leave, but lots of things needs to be done in a very short period of time. Thank you to all speakers, and I will later also watch the André Andonian's speech too, to understand the economic impact too, because of course I'm a Minister of Health, but I'm also a member of government of the country that has this challenge. So all speakers have very useful information for us, and I think these kind of webinars or web-based meetings are very useful. I would also like to one more time to thank you, Ruben, and ask if there are any new speakers or anything needs to be updated in a week, two, or in a month. I would be happy to present and to discuss issues again. And thank you to all of you, and have a nice conversation later on. Thank you.
Thank you for everything. Thank you. And we'll wish all the best for Armenia, and hope everything will become better. André, yeah.
Yes, hello. So thank you very much. Thank you, Ruben, for the very nice introduction. And I'm very honored to be here as a panelist with so many illustrious friends and colleagues. And the question you asked about the economic impact, I wish I had the exact answer. I think everybody is looking for that. And what we are doing, and I think I want to build also what Lord Darzi said earlier, Ara said, we are also based on facts. So as McKinsey, we are looking at the facts, and therefore we have developed various scenarios. And the scenarios depend actually on safeguarding, on one hand, lives, like what happens actually to save lives. And the other hand is to safeguard livelihood. So basically the way of creating, if you want, value, having jobs, earning, and so on. And if you're in a lockdown, this is hampered. And therefore the scenarios have actually two axes. One is on the on safeguarding lives, how effective are the measures that are being put in place, and how the spread of the virus is contained. So if it is very effective, then usually the impact is 2 to 3 months only, I put it this way. And therefore on the economic side, I think the rebound is faster. If it's like a medium scenario where you have some resurgence, but you more or less, I think, prevent, if you want a catastrophe, a global one, then I think it takes longer the recovery. So it may take like 2 years longer, and I will come with specific scenarios. And if it's a broad failure, then it will be probably the biggest depression we ever have experienced. Yeah. So that's that axis. And then on the economic side, it also depends what actually governments are doing, what companies are doing, and what the action is. Again, here, if there's an effective intervention, so there are policies that prevent that there is structural damage, and the pre-crisis fundamentals are kept, the recovery will be faster. The medium scenario is that partially these interventions are successful, like the banking crisis is avoided as an example. And then the recovery will take longer, but you eventually will get to the levels where we were used before. And then obviously you have again a catastrophic scenario. If there's widespread bankruptcies, the banking system collapses, and that will be a disaster. So you have 9 scenarios if you take those. It's 3 axes and the intervention, you know, and then on the economic side. We believe as McKinsey right now, we don't see that as black. So we are basically saying these very negative scenarios. At this moment, there is no reason to believe that will happen. So we are probably more in the middle scenarios. And I'm going to basically take 2 middle scenarios that at this moment, I find they are likely. And as we are speaking, we are observing and trying to get additional facts to get, you know, those scenarios more concrete. If you take like a scenario where the virus spread is being controlled quickly, like it's in 2 to 3 months, you have that under control. And the economic measures are like the medium scenario, what I just mentioned. There, I think there basically what will happen is that the GDP in the second quarter of the world GDP will decline by 4.9%. And we will end up with the GDP worldwide 2020 end of the year with minus 1.5%. And we will get to pre-crisis levels end of the year. So this is like a scenario that is more on the optimistic side. The effects are different by countries. So if you take the Eurozone, the effect will be deeper. And we heard actually a bit in the discussions, it's very difficult to get an aligned reaction on the European side. And therefore it hampers actually also the economic activity. So in the Eurozone, we would think that the drop in the second quarter would be 9.5% in GDP. And the GDP would end up with minus 4.4%. That would be our forecast. And Europe would be like 1 quarter behind the rest of the world in terms of recovery. Yeah. On the other hand, we believe that if China and Japan stay the course as they are right now, they will be pretty much the fastest out. So in the third quarter of 2020, Japan will manage to get to a 0 GDP growth, China minus 0.4. And the US is like in between. This is like that scenario. And then if I take another scenario, which basically is one where the virus spread is only the medium scenario, not the optimistic one. So you have some resurgence and things coming up. That's where actually the recovery will be only in the third quarter of 2022. So we are talking about a long period here. And the GDP in 2020 will be minus 4.7% worldwide. In the Eurozone, minus 9.7, US minus 8.4, Japan minus 5.6, China minus 2.7. So the spread is really wide. And I want to underline what Ara said. Also, it's extremely important to try to contain the virus as fast as possible because it has major economic impacts the longer the situation continues. And if we make now comparisons, because you asked how big is going to be the depression, actually right now for the US, we believe this is going to be the sort of the biggest, probably it may reach the big depression, but definitely it will be the biggest one since the Second World War, the effect in the US. So we are right now thinking between -8 and -13% on the US in terms of real GDP percentage from the peak to the trough, approximately. Yeah. And you have seen other forecasts from investment banks who came out for the second quarter, like Goldman Sachs, Morgan Stanley. They're all like between 24 and 30% drop in the next quarter for the US. So it's actually in line a bit of what you are saying. The other important message I would like to give is that this effect will vary by industry. Different industries are affected by the crisis in a different way. Actually, right now, I would say the retail business is actually benefiting. And many of the stores, like in Japan, have record sales. because people don't go out to eat in restaurants. They cook at home and they buy things in bulk. So they have actually, they're selling right now more in this basic retail goods. Whereas apparel, fashion, luxury, things that are not really needed, they are down minus 35% as an example. And right now you can see that oil and gas is hit the most right now with minus 60% as an example. So the range is very big between industries, and this the recovery from those industries will also vary, because if you're coming from a very low base, it takes longer to go up. So for instance, aerospace will take longer, air and travel will take longer, whereas retail as an example, or even automotive may take faster. Once the supply chain in automotive, the supply chain is fixed, that could go faster, yeah, as an example. I would like to also underline what Noubar said, and it's very much also in line of what we are thinking. I think every crisis has also an opportunity, and the first thing obviously is to survive. We call it actually to resolve and resilience. So these are the first two steps. And this is true for individuals, this is true for companies, it's true for governments, that we really have to make sure that we survive, yeah, first thing. Secondly is returning to work, and Noubar mentioned to that. Here we have to think, and Ara also alluded, we cannot stay in a lockdown forever. So we really have to think, when is the right time? What markers and indicators do we need to know on the health side? When is it safe to get back? And what precautions are we going to take? And we have to think about that and make sure that we can get back in order to get the economy working again. And then this phase of reimagination, we call it, of the new normal. There will be a new normal. So the future will not look the same. Some positive effects we are seeing, for instance, in digital. There was a lot of debate that there are much more opportunities in doing things in digital, but behavioral change is so difficult. This actually crisis is accelerating that. So we are seeing like customers of banks, customers in retail, even other processes are being digitalized as we speak. And we believe, I think they will stay. Many of those things will stay digital, so they won't go back. So that could be an opportunity. And then the big area, and Noubar alluded to that, is the reform, actually, the way we think about our healthcare system or sick care, as Noubar mentioned. And the way, actually, I think it was very, very informative for me how Dr. Navarro also was characterizing the restrictions that the WHO is facing. And the question is, if we really want for the future to be prepared, whether we have to think the overall, I would say, governance and overall decision rights and how we are approaching these things on that level. And this is also true for company levels. And I would like to also say a couple of words. What is it actually what we are currently recommending? Because we're helping now as McKinsey, mostly actually on pro bono basis, governments in their decision making and how to approach. And the first thing is obviously to maintain and we are only economic advisors, so we cannot advise on the medical epidemiological side. But on the economic side, the first thing is, how do you maintain household economic welfare? So basically, if you're out of a job, don't have any savings, you have to still to survive. And there have to be programs in place to make disposable income available fast. You need some employment safeguards, some retraining, regeneration, we call it. That's extremely important. Then in terms of the companies, to make sure that they keep their liquidity and their cash flow, because otherwise they will go bankrupt. And the question is also, those who are losing their revenues, how are they going to, what are any other businesses, adjacent businesses, are there any ideas they can approach? And obviously some cost reductions that could be done in the short term. And then last but not least is the financial stability, the monetary policy actions, and the prudent, we call it always, financial measures to relax, for instance, adequacy requirements for banks in this special situation, it's important to have the right guidance here. And last but not least, I would like to also stress what both Ara and Noubar said. This stage is extremely important to understand. There are many unknowns, but there are also many facts around. And we are experiencing that those facts actually are in different places, and it's very difficult to get the overall overview. Therefore, we are recommending to create a nerve center, that's for our companies, that really get all the information that exists in one place and use that to see how the companies can protect their employees, protect customers, look at their supply chain and see how it can be stable, look at with the customers to see how they can stay close to the customers, even though there is no physical or in-person interaction possible. And it's also important that they do financial stress tests, so make sure their cash position is there so they can stay afloat. And last but not least, the morale and the motivation of the employees is very important. So it's very important for the companies to remind what is the purpose of the company and what are the employees, why are they so important? Because I think the spirits and the positive thinking is in this situation important. So if I might summarize, I think we are right now at the beginning. So we are right now trying to survive, I think, to what Noubar said. We are probably in that phase and not trying to get to the next phase of revival. So that's where we are right now. There are obviously thriving opportunities that we should think about. Yeah. And overall, I think collaboration, and I think this what you're organizing, Ruben, is very important. So all of us have the same information and can help in a more, if you want, in a systematic way. And then the last thing on Japan, you asked me, I'm talking here from Japan. I'm sitting here in Japan. Japan is actually one of the few countries currently that is not under lockdown. So life in Japan is close to normal. So we have in-person meetings. We go to the supermarket, we have goods there, we have domestic travel. And the reason I think Japan is where it is first of all, it took measures very early. It's close to China. It was one of the first countries that actually closed the border to those areas where the infections were high. Very, very early Japan closed the schools, closed the gyms, closed public spaces, closed restaurants where the tables are too close, so the social distancing was applied. And then Noubar had it on his chart. Japan has also very strong social norms that help in this situation, like wearing masks, obedience of the population if there are some restrictions being imposed. And this have helped so far. And I'm saying so far because over the last week I have seen some carelessness in the general public. And I'm really hoping that we stay and the Japanese stay disciplined so we can continue as is. And like 3 days ago, the governor of Tokyo, Koike-san, basically said if we basically continue to be careless, she's willing to do a lockdown for Tokyo. And I'm hoping that people are following that. So that's the situation in Japan.
Thank you very much. Thank you, dear friends, partners who been together with us today, and with people who joined to the webinar, the thousands of people who been following with our discussion. And I think you touch very important points, and it's so many of them. And unfortunately, one of the challenges that we are facing, people don't know which part of take care, because it's a ideal storm when you have so many issues that needs to be handled, moral, ethical, to the infrastructure, for healthcare, to economics or culture, behavior. We are joking in Armenia, finally the men will not kiss each other after this coronavirus, because it was part of the Armenian tradition and will now be gone. And it's a joke, but it's also a serious issue about the change of the behavior. It's not only a question about how you can save the lives of people, but how you differently behave is becoming one of the important issues. And social distance, information sharing, we are learning. And I'm again apologizing in the beginning with some technical problems of my voice and couldn't make introduction, but the proper introduction of all the panelists. And again, I want to say thank you for your time and your willingness to share very important information. One thing I believe strongly, what we need to talk to each other. We need to share experience and knowledge. We need to understand what is not only state or international organization's responsibility to solve this problem. It's entire our society needs to be involved, and by following rules, by learning some new way of behavior, or being volunteers, or just being a proper responding of the crisis, economical and financial, which will coming also together with this healthcare crisis. And it's easy to say, it's more difficult to do it. I believe what we've been starting doing in Future Studio, it was a couple of days ago, our very distinguished professor, Dilijan, made the presentation about the capitalism and how to capital transferring. We are started to do this discussions available in our Future Studio in a technological way, not yet in physical space, but we believe one thing, it will become important to really talk to each other, to learn, to share experience, what's happening in Russia, what's happening in Japan, what's happening in the US, what's happening in the UK, how the different industries are responding, how different groups of social are responding, how you can share the experience. We got a lot of suggestions for different Armenians from different part of the world, saying we can share the Spain. For example, the woman from Spain hospital said, "I'm happy to share what is our following the instructions and the process was in Spain to help Armenians." I think we can talk about how we can really use all this knowledge and experience for Armenia or for other places in the world. And of course, there was a lot of questions from diaspora Armenian, how we can help to Armenia, how we can be part of this. It was a lot of questions about how we can learn more about what's happening in Sweden or what's happening in Japan, and how it's different between the China. Why is China win so quickly this fight, and they're getting less infections, and many other questions which we cannot cover in 2 hours time. It's too short, and we have no time to discuss so many aspects of the discussion which was raised. And I think it's a very important beginning of this type of the conversation. I hope we can continue with dialogues, and I hope we can continue with the Future Studio and Armenia 2041 platform and the Crossroads book, which was been written together with Nune Alikian and with the Noubar and myself, giving ideas about future with using the experience of last 20 years. I want to say thank you for the FAST Foundation and all the team from FAST who did this amazing technological work, and of course the people who've been organizing from Future Studio and the other IT guys. And I think one thing which I see it now is ecosystem of which we've been building last 20 years now, starting more work. People see more needs to become together. People see more needs to base their family, by the way, staying more at home, and many of us are facing now new opportunities and challenges of the relationship with the families inside the family, because you're staying at home, the kids at home, and all is creating also some interesting new challenges and opportunities of feel more importance of the families and network. That's why I won't just finishing this discussion saying how grateful are all of you to be part of this discussion, and I want to say personal thank you, Noubar, Lord Darzi, André, to being together with all years, and what we've been doing, I think it's become more relevant. I believe Aurora and what Noubar said is very critical. What we've been really doing is gradual action, and being human, staying human with human values is becoming critical for all of us, because it's not a question about somebody is responsible. It's all of us responsible to keep the world. And I want to say for all of us, just we stay together. And I want to say thank you. If any one of you want to say a few words at the end, I'm happy to give. Nobody want to say, please.
Just Ruben, to put a finer point to what you just said, just add one last thing. I think, the Aurora movement and many of us have been engaged in humanitarian activities. And for us, before this crisis, humanitarian activities involved conflict zones, danger zones, far away from where we live, where we were able to provide support, help, encouragement, visibility, but it was always outside of our daily lives. We have every single person on this call, every single person watching this has a unique first-time opportunity to themselves be a humanitarian. A humanitarian is somebody who is concerned for helping to improve the welfare and happiness of people, particularly saving human lives and alleviating their suffering. Their suffering within 10 meters of every one of us these days. and there's opportunities to be humanitarian. And if that actually changes the nature of how we operate in the modern times as humans with humanitarian obligations and feelings, I think some good will come out of this. And so I would just ask everyone to think about, as Ara said, the volunteerism, the sacrifice, the support to Armenia. All of these now are humanitarian activities, and everybody needs them. Our neighbor needs them. So I just want to emphasize just what a unique opportunity this is to embrace this otherwise highest order of expression, self-expression.
I agree. Ara, André, if you anything just to end to say, I'm sorry, we have been running 2 hours so quickly, and we have so many more questions. I want just to be saying again, we hope we can continue these conversations. I hope we can find other way how we can share experience knowledge, and I hope we can continue do this regularly. And we hope also we can answer. We got thousands of questions, and we will try to answer some of them in a written forward. We keep some way to this mechanism of the dialogue in life and using the Future Studio platform. And again, thank you, Astig Oganisyan, and all the other people who work with you to doing this. We hope we can improve this all. Please, by also send suggestions how we can do better. I want to just say it's again big privilege to be part of this network and learn from each other and try to work together to do something. It's really important for the human worldwide and also for Armenian. Thank you, and stay in touch. And we hope we will have a more positive discussion later, and we will be helping make the world better and easier to solve some of the biggest challenges we are facing in history of the 21st century, definitely. Okay, bye-bye.
Thank you.
Bye. Thank you.